Hey everyone, it's Samantha Jamerson. Welcome back to my channel. Today we are going to be talking about a very common and popular topic known as adult female acne. So if you are interested, please keep watching. So adult female acne, like I said, it's probably one of the most common medical conditions I treat at Center City Dermatology. As I've told you guys before, I am a physician assistant and I practice in dermatology. So I know I show you guys a lot of the Botox, the filler, like the fun things, but I also practice medical dermatology as well. So acne is probably one of the most common conditions, and more specifically, adult female acne is extremely common among my patients. This type of acne is going to be different than your normal teenage acne, which if you think back to when you were a teenager, or if you knew people who struggle with acne as a teenager, that acne was kind of consistent of little tiny pimples, most consistent in the T-zone area, which will be your forehead down to your nose and to your chin. They're not usually the deep, painful, inflammatory pimples. They're more the little tiny pimples that we get when we were younger. So adult female acne is different in that it's characterized as these cystic, deep, really sometimes tender and sore inflammatory acne that usually affects women. Of course, it can affect women as early as in their 20s all the way up until their 50s. And it's usually located mid-cheek area down to the jawline, the chin, even into the neck area. And more specifically, it normally occurs around a female cycle. It doesn't necessarily have to occur when the woman, has her period. It can be during ovulation, right before her cycle, right after her cycle. But this type of acne is stubborn because a lot of my women say that it's under the skin, it'll last for weeks, it's super tender and painful, and it doesn't necessarily come to a head, and therefore they can't pop it, which we don't recommend popping them anyway. But the good news is there is an amazing treatment option that is out there for this type of acne. The number one treatment option for this type of acne is a pill called spironolactone. This pill, I would probably say I put around 85% of my female patients on if they're willing to go on it, including myself. I have been on spironolactone for probably just under 5 years now. I did get off of it a little bit, probably for about a year when I was trying to conceive with my son, and while I was pregnant and breastfeeding, you can't be on it, but then I got right back on it when I was done. This medicine is amazing for the deep, painful cystic acne that women get. Topicals are good, and I'm going to go through some of the topicals that I recommend, but there is nothing that works, in my opinion, as effective as spironolactone for the deep under the skin types of pimples. So how does spironolactone work for adult female acne? Well, spironolactone is anti-androgen, which basically means it slows down the body's production of making androgens. Androgens can actually make your oil glands secrete excessive oil, which is going to make your skin get clogged and it's going to break out more frequently. So if you take spironolactone, it basically blocks the production of that androgen, so therefore you don't secrete too much oil and therefore break out. Now, only females can take this. If men were to take it, which we don't ever prescribe for men, if they were to take it, they would actually get the opposite effect, and they could actually get something called gynecomastia, which is where men develop breasts. So we do not prescribe this to men. It is only for females. And the side effects are actually very minimal. The side effects that I counsel my patients on are lightheadedness or dizziness, and that is because, if you didn't know this, spironolactone is a blood pressure medicine. So it technically has the effect to lower your blood pressure. Now, I do have females who have low blood pressure who are on this medicine and don't have any side effects with it. I also run low with my blood pressure, and I don't normally feel lightheaded or dizzy while on this medicine. One way to kind of counter that, I always recommend spironolactone to be taken after dinner, before bed, so that you are laying down, for a couple of hours instead of like getting up first thing in the morning and taking it. I also find that women don't eat that much in the morning, including myself. So if you take this medicine on an empty stomach, and since it is, a blood pressure medicine, it may make you feel a little lightheaded or dizzy. The other common side effect I counsel my patients on is that it can cause irregular cycles. Women who are on birth control, oral contraceptive pills, are less likely to have that to happen, including myself. Like, I'm on birth control and I'm on spironolactone, so I don't get any issues with my cycle. But some women, I find in my experience, because I've been doing this for 5 years now, If they are not on a form of contraception, then their cycles can get a little bit irregular. It's not dangerous, but it's obviously annoying. So if that happens, sometimes it's just as easy as changing the dose of the medicine to make sure that side effect doesn't happen. Other side effects of spironolactone include headaches, breast tenderness, and something called hyperkalemia. Hyperkalemia is increased potassium in the body. Now, this can be potentially dangerous. We know that increased potassium can actually affect your heart. So I don't tell this side effect to scare my patients. I just tell them to be aware that if they were to go up to the higher doses of spironolactone, which are 150 milligrams or 200 milligrams, which I do have some patients on, I just require blood work on them once a year so I can monitor their potassium levels to make sure they don't get too high. Most commonly, I start my patients off at 50 milligrams, and then we revisit in a couple of months if they're seeing improvement, or if they're seeing improvement but they're still breaking out a little bit, then I go up to 100 milligrams and I go up, thereafter. So this medicine, hands down, is the best for adult female acne. Like I said, not only do I recommend it to 85% of my female patients, I'm on it myself. So I'm a firm believer in it since I take it myself. Two other topicals that I recommend for adult female acne is a prescription topical called Axone or Dapsone gel. So the reason why I like Axone is because out of all the topicals out in the market for acne, the biggest side effect is that they're going to dry out your skin. So what I like about Axone is it's extremely tolerable. I put it on every single morning. It doesn't dry me out, doesn't irritate me. It does not contain benzoyl peroxide, so I don't have to worry about any skin bleaching or whitening or anything like that. And it really helps out with that kind of hormonal acne, the redness associated with it. I am fairer skin tone, so every time I break out, I get redness associated with it. So I think Axone does a really nice job at calming down the acne, calming down the inflammation, and helping out a little bit with the redness. And then at night, I always recommend my females be on some type of anti-aging topical, whether that be a retinol or a retinoid. So there's prescription retinoids, which I obviously can prescribe to my patients, or they can do more of a product-based topical, such as a retinol. And what's great about those topicals, if you've seen my other videos, I've discussed it, retinols are great for anti-aging. They're great for wrinkle prevention, and they can help soften wrinkles if you already have them. They can also help with oil production. So if you're someone who's super oily and gets congested easily, it's super easy to add a retinol or retinoid to your routine. So not only are you treating the inflammatory cystic acne, you're also anti-aging at night. So spironolactone, Axone, and a retinol or retinoid at night is my go-to treatment plan for women who struggle with adult female acne. So that's about it. I hope you liked this video, and I hope you learned something. And if you like this video and want me to do more about medical dermatology, since I know I show a lot of the cosmetic dermatology, comment below and let me know. Otherwise, I'll talk to you guys soon.